I'll be talking to you about epilepsy. Epilepsy or fits occurs because of an abnormal electrical discharge in the brain. This happens in many patients because of some scar or injury or tumors, and in about half of the patients there won't be any cause for epilepsy. The diagnosis of epilepsy is entirely based on the description provided by an observer or a witness. There are many types of epilepsies. We may require some investigations like EEG or MRI to further classify the type of epilepsy and decide on the treatment. In vast majority of patients, the seizures can be very well controlled with anti-epileptic drugs. There are some basic lifestyle requirements which will help to prevent the recurrence of seizures. This includes proper sleep for 7 to 8 hours, to have food on time, avoid undue overexhaustion, avoid emotional stress, and practice of relaxation techniques like yoga and meditation. And of course, it's very important to be on the drugs on a regular basis. The drugs used for epilepsy are control of the disease. But if there is a good control for a long duration of time, we can attempt to slowly reduce and stop the medicines. And most of the patients become seizure free after a particular span of time, depending on the type of epilepsy. In some types of epilepsies, like the benign childhood epilepsies, we may not even treat those children because the epilepsy goes off with advancing age. Now, in about 20 to 30% of patients, the fits don't stop in spite of medications. And here we try to take out the focus from the brain by doing a surgery called epilepsy surgery. Now, this is done by identifying the focus using an MRI, by doing video EEG, and sometimes advanced investigations like PET scan and SPECT scan or MEG. And then we put in electrodes inside the brain if the focus is not easily seen by the above investigations. And ultimately, removal of the focus results in seizure freedom. Many patients with epilepsy, although they are absolutely normal, face a lot of discrimination. This happens in their personal life when they get married or even in employment. Remember that epilepsy affects a person only for a very fraction of a time during his life, and during rest of the time he is mostly normal. So most patients with epilepsy can lead normal lives, can work, can marry and have children. So let's all work together to improve the quality of life of persons with epilepsy and make life easier for all these persons. Thanks for listening.